Good morning. If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a large number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. The art of the therapeutic embrace in direct clinical hypnosis. The hack. Human beings need contact, both verbal and non-verbal. Within the non-verbal language, we have physical contact, and one of the most important forms of physical contact is the hug. It has been proven that we all need physical contact to feel good. Physical contact is not only pleasant, but also necessary for our psychological and emotional well-being. Giving or receiving a hug can be therapeutic. The theory behind this therapy is that physical contact is not only good but necessary. Scientific research supports this theory. It tells us that physical contact or physical stimulation is absolutely necessary for our emotional well-being. A hug makes you feel good. The skin is the largest organ we have, and it needs a lot of affection. It is also a way of communicating, because with a hug you can say things for which you have no words. The best thing about a hug is that you can give one without receiving another. The one who hugs is also hugged. We live in a world where different languages are spoken. Hugging is a universal language and contributes in a very important way to healing and health. Sometimes we cannot find the right words to express what we feel. Other times we find them, but we do not dare to say them, either out of shyness, embarrassment, or because our feelings are too strong, out of embarrassment or because the feelings overwhelm us. In such cases, we can rely on the non-verbal and universal language of hugs. It is very important to give and receive hugs, to feel our heart warmed by the warmth of a good hug. A hug says and does so much. A hug comforts us, helps us to express our feelings, gives us confidence, relaxes us, gives us security, calms us, strengthens our self-esteem, releases our tensions, chases away loneliness, calms our fears. It combats insomnia, strengthens the immune system, and delays aging. It is even dietary because it helps to reduce appetite. In the family home, daily hugs strengthen relationships and significantly reduce family friction. Hugging should be mutual. That way, it will be effective for both the giver and the receiver. Many people limit themselves to the usual hugs. For example, the right kind, the kind you give at a wedding, on a birthday, at Christmas, and little else, and even avoid them if possible. There are families who don't even hug each other, children who don't hug their parents, siblings who don't hug, and even friends who only shake hands and never go beyond that. Hugging has also been misunderstood and degraded. Where have we got to? When hugging is necessary, beneficial, and natural, experts say that we need 4 hugs a day to survive, 8 to maintain ourselves, and 12 to grow. We say at least 1 hug a day. Being hugged is enormously therapeutic. Where are you when I need you? I can't find you. I need a hug. I need the warmth of a good hug. I need to feel hugged. Where are you when I need you? You are never there. I just ask for a hug, a miserable hug, and nobody gives it to me. Maybe it's my fault, since I never hugged anyone. I was never taught how to hug. I'm probably not used to giving hugs, nor to receiving them, nor to ask for them. But now I need a hug, and nobody wants to give it to me. Maybe I don't know how to ask for it, or I was not taught how to ask for it. I just ask for a hug. These are the words that a depressed patient told us. What do we do in this case? We simply get up from the chair, extend our arms so that the patient comes to us to receive the biggest and most affectionate of hugs. If we see that he or she does not come to receive the hug because of embarrassment or other reason, then we go ahead and hug him or her. We have to embrace our patients, give them a warm, affectionate, and sincere hug. The patient should feel comforted and supported by this embrace. They should see that we are involved with them in the therapy, that we take everything they tell us very seriously. A warm and affectionate hug can have very positive effects on our patients, particularly in times of stress and tension. As the hug produces a feeling of companionship, support, and happiness, we are absolutely convinced that a hug can prevent and even cure a host of different problems. We will give a hug to the patient regardless of gender, race, or religion. The hug is universal. It does not discriminate between the sexes. Hugging is like water, and water is not denied to anyone. Hugging is an excellent and effective tonic. Therapeutic hugging. There are couple hugs, friend hugs, farewell hugs, and reunion hugs, hugs of pure affection or simple protocol, hugs from father to son, and from son to father and mother, short and long, tight and shy. There are many different ways of hugging. We are going to comment on how we practice this technique, which we call therapeutic hugging. The therapist is the one who takes the initiative in the hug. That is to say, it is one who gives the hug and the patient who receives it. With both therapist and patient standing, we gently wrap our arms around the patient, with one arm over the shoulder and the other arm at waist level. The patient rests their heads on our shoulder and face, depending on the height of the patient and the therapist. And the bodies touch in a warm and loving embrace, which can last between 10 and 15 seconds. The position of the hug is not really very important. What is important is that it is therapeutic and effective. During the embrace, we must transmit to the patient security, understanding, confidence, etc. If we see that the patient does not withdraw, we continue hugging the patient. During the hug, we say words such as, "I understand you. I'm going to help you. You are going to get through this." The therapeutic embrace is an intense emotional and physical interaction, which touches and heals the deepest wounds and awakens love for life. Through the hug, we recover our self-confidence, our personal power. We discover the potential we have to live in unity, belonging, security, and joy. Hugging and being hugged is one of the best feelings in the world. It is also therapeutic. The most precious thing we can donate is our touch, letting our own skin know and transmit the feelings that each one of us carries inside. Why do our patients and some therapists find it so difficult to make this donation of touching and hugging? Surely they are not used to it, or perhaps they have not been taught, or they are embarrassed. It is we, the therapists, who must break the ice and give our patients a real and sincere hug, so that they feel our help and company in their suffering. In that embrace, we live an incarnation of happiness and luck, of love and hope, of companionship and understanding, of sincerity and empathy. We understand that human beings do not live by bread alone. They also need tenderness. The embrace between therapist and patient is the best representation of therapeutic accompaniment. The hug says and does so much with so little that it is very difficult to refuse it. If you're interested in learning more about clinical hypnosis, please watch our next video, Direct Clinical Hypnosis, Diagnosis and Treatment. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. If you have any questions, add them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we will publish. So, if you're interested, do not miss our next videos. Thank you very much for your interest.